Why should you take care of your denture and real teeth? The health of the real teeth and gums will be affected if you do not take good care of your denture. Although a denture is in close contact with real teeth and gums, food debris and dental plaque can still accumulate at the gaps between a denture and gums and at spaces between a denture and real teeth. The risk of having tooth decay will then be increased for the adjacent teeth of the denture. Also, the gums in contact with the denture may inflame easily, which may result in losing the remaining real teeth. Methods of caring denture and real teeth. For denture wearers, they have to clean the adjacent teeth of the denture thoroughly every day, once in the morning and once before bed. You can use a toothbrush, dental floss, interdental brush, or single-tuft toothbrush to remove dental plaque thoroughly. The denture must be taken out for cleaning every night. Apply some detergent onto the toothbrush. Then brush every surface of the denture. Pay attention to brush the parts of the denture which are in contact with real teeth and gums, especially the inner surfaces of the metal clasp. You may use the denture cleaning tablets regularly. However, this cannot replace the use of a toothbrush to clean the denture. Remember to immerse the clean denture into a cup of water and leave it there overnight. Never wear the denture while sleeping. Every day, it just takes only a few more minutes and you can keep a tidy look, fresh breath, and good oral health. At the same time, your teeth and denture can last longer and maintain the best chewing function. However, because of the different oral conditions, these basic cleaning methods may differ from one another. Dentists are pleased to give you professional instruction on how to improve your oral health care techniques. However, it all relies on you yourself for daily oral health care.